Hi, I'm Tracer Foster, a home healthcare agency business consultant. Welcome back to the Home Healthcare Administrator Training Program, Module number 4. In this section, we're focusing on operational excellence and the essential policies and procedures that keep your agency running efficiently, safely, and in compliance with industry standards. Having a clear and well-documented operational policies manual is key to providing consistent, high-quality care while ensuring regulatory compliance. We'll cover how to establish standard operating procedures, develop an emergency preparedness plan, and implement infection control measures. These will be helpful to you to prepare for accreditation as well, if required. Let's start with the foundation of daily operations, standard operating procedures, otherwise known as SOPs. SOPs usually follow state licensing laws, so be certain to check with the state licensing board where your agency conducts business to ensure compliance with regulatory requirements. SOPs serve as the backbone of your agency's operations. They provide step-by-step guidance for your team, ensuring consistency in patient care, compliance, and efficiency. Now, you might be wondering why SOPs matter. Well, they ensure consistency. All of your caregivers and staff will follow the same protocols for the delivery of care in your clients' homes. Next, they improve efficiency. They'll reduce confusion and streamline your workflow process. They will enhance compliance. They'll meet legal, regulatory, and accreditation standards. And finally, they'll support training and onboarding. New hires can easily and quickly learn your agency's policies and procedures. If you're unsure as to whether or not your agency can provide a particular service, pull up your state regulations and look for the answer, or dig through your policies and procedures manual. Just be sure that your policies and procedures match the state laws and licensing board requirements where you operate. Next, some key SOPs that every home health agency needs. Some of the most important ones will include patient intake and assessment. This includes steps for onboarding new patients, conducting assessments, and creating care plans, and which staff members of yours will handle this process. Medication management. This is the proper administration, documentation, and storage of these medications in the patient's home. Caregiver scheduling and assignments. These are guidelines for matching caregivers with patients based on their needs and qualifications, as well as their personalities. Infection control protocols. These are procedures to prevent the spread of infections in the home or in your office setting as well. And finally, emergency response. These are actions that your staff must take in medical emergencies, whether they're in the home or the office, including natural disasters or other security threats. Don't forget regular practice drills as well. SOPs should be well documented, easily accessible to all staff, and regularly updated to align with industry changes. Next, let's discuss preparing for emergencies. As you know, emergencies can happen at any time, and as a home healthcare administrator, you must have a well-structured emergency preparedness plan to protect your patients and your staff. Examples of some types of emergencies you should prepare for include medical emergencies. This could be patient falls in the home, cardiac arrest, allergic reactions, and this could apply to either your patients or to your office staff. Next would be natural disasters such as hurricanes, floods, wildfires, earthquakes. These are just a few examples. Public health crises. This includes pandemics, outbreaks, or other biohazards. Next are security threats, including home intrusions, violent situations, or other abuse-type cases. Now, the key elements to a successful emergency preparedness plan include having a correct emergency contact protocol. You'll need to establish a chain of command for reporting incidents. Keep an active phone tree of who is responsible for which task in the event of an emergency. Be sure to update this report regularly so that you have current staff members, not people that may have already left the company. Next, evacuation and shelter plans. Provide clear instructions to your office staff and to your patients and caregivers, and be sure that they are aware of any medical shelters in the area if they may be needed. Also, have backup communication systems. Ensure that your staff can communicate during power outages or network failures. Be sure you have printed copies of your patient census, your employee roster, and any other scheduling information you might need should the power go out. Don't forget the staff training and drills that I had previously mentioned. Regularly train your caregivers and have drills on emergency response procedures. These should take place every 6 to 12 months. And finally, collaboration with local authorities. Be sure to work with your emergency management systems, your hospitals, and public health officials to coordinate care during crises in your area. Emergency preparedness is not just about having a plan, it's about ensuring that you have trained your team and they are ready to act at a moment's notice. Now, let's talk about infection control and safety policies. Preventing infections is a top priority in home health care. Patients often have weakened immune systems, making them more vulnerable to illnesses. A strong infection control program protects both patients and caregivers alike. Some key infection control measures include good hand hygiene, proper hand washing techniques in the home and in your office, and the use of hand sanitizers will help stop the spread of disease. Next, personal protective equipment or PPE. Have guidelines for wearing gloves, masks, and gowns when appropriate. Disinfection protocols, cleaning and sanitizing medical equipment, supplies, and other frequently touched surfaces, again, in the home or in the office. Have proper waste disposal, safe disposal of sharps, biohazardous materials, or soiled linens in the home. Vaccination and health screenings. Don't forget to remind your patients and office staff and field staff about vaccines such as flu shots or COVID vaccines, TB testing as well for your caregivers. Next, preventing the spread of infections in the home care settings. Screen your patients and staff for symptoms. Daily health checks or checks at each visit, and report the symptoms back to the office supervisor immediately. Teach infection control and infection prevention to families. Educating caregivers and family members on proper hygiene practices can be very helpful in stopping the spread of disease. Use isolation precautions when needed. For patients with contagious diseases, follow CDC guidelines for care. If you are unsure about a particular situation, please reach out to the office staff, your supervisor, or your on-call nurse. So that concludes our session on operational policies and procedures. Today, we covered how to establish standard operating procedures, develop emergency response plans, and implementing infection control measures. By putting these policies into practice, you are not only protecting your agency from legal and regulatory risks, but you're also ensuring that patients receive safe and high-quality care and are also well-informed. If you have found this video helpful, please like it and subscribe to the channel. In our next session, module number 5, we'll dive into human resources and staff management for home health agencies. Thanks for joining me today, and I'll see you in the next video.